Hey guys, it's Cherry. Let's talk a little bit about taking tests well. I hear all the time from students, they tell me I'm not a good test taker. And most of us don't get into EMS because we're good test takers. So this kind of makes sense. The other thing is there's an art to taking tests, just like there's an art to being a good EMT and a good clinician. We teach you how to be a good EMT. We really don't spend a lot of time teaching you how to be a good test taker. So let's see if we can take the next 15 minutes or so and sharpen up those skills. Okay. First thing with taking a good test is know your terminology. Okay. If you don't know the terminology and you get a test question with a medical term on there, you're just dead in the water. If you don't even know what the question is asking for because you don't understand the language, you might as well be taking this exam in Latin, okay? So know your terminology. Grab a hold of a list. In our courses, we provide you with a list of terms that you need to know, but you've always got terms at the beginning of the chapter that are listed. Know what those mean. If you don't, then you get to take a guess, and that's as good as it's going to be, okay? If you know the meanings of some of the prefixes, the things that come before the word or at the end of the word, then, or maybe if you know some of the root words, you can at least take an educated guess. So let's look at what that might look like, okay? This particular word, hypoxia. If you don't know what that means, then you can't answer the question, really, to be honest. But if you know what the hypo means, hypo meaning not enough of, then you're at least halfway there. I know it's not enough of something, okay? So dig in there and look and see, what is the other word? We know the IA at the end means a state of. So what's left is that X. So if we look at the OX part of it, OX, the word that comes to mind when I see OX is oxygen. And I don't really know anything else that starts with OX. So what if this word means not enough oxygen? Okay, if I break that down and look at it, I would be correct. This word means low oxygen or not enough oxygen. Okay, this word, dyspnea. A lot of people are like, oh, I don't know what that means. Okay, so think about that first part of this word, dys. Do I have another word that starts with that? So for me, probably because it fits, dysfunction. Okay, I have a dysfunctional family, which basically, if I break that down, means we don't function well. Okay, so dysfunction. Dys kind of stands like difficulty functioning. Dys is difficulty or trouble with. Okay, so if I break that down, look at the root word, which is that PNE. A word that starts with PNE that kind of comes to mind for me is pneumonia. And I know that because it's not spelled at all like it's pronounced. So PNE is pneumonia, which is an infection in the lungs. So I'm kind of thinking PNE that comes could be an infection, but it could have to deal with lungs and breathing. So the word pneumothorax also starts with PNE. That has to deal with my lungs and breathing. So if I kind of put those together, dys being difficulty and PNE having to do with lungs or breathing, then dyspnea could have difficulty breathing. Okay, so learn those and it makes this whole process so much easier. Okay, all right, let's set ourselves up for success. So number 1 is know the terminology. Okay, the second step we're going to do, especially when it comes to scenario-based questions, is to just read the question. We're not trying to solve it. We're not trying to come up with a solution. We're not trying to come up with a treatment plan. Let's just read the question, all of it. Take your time, read it, and then we're going to ask ourselves at the end, what is this question asking for? It could be asking for what is your very next step. It could be asking for what do you think is wrong with this patient. It could be asking for what treatment plan is most appropriate. It could be asking for all of these are signs and symptoms except, okay? If you miss that word except, you're going to answer this question wrong. So read it and ask yourself, what's it looking for? It's a very quick, really good, healthy start to taking a good test. Okay. Now, in a scenario question, the next thing we want to do is we want to look and find the abnormalities that we are seeing in the patient in the scenario, those things that are not normal, because normal things don't have to be fixed. All right. So identify the abnormalities, and then once we have that list of abnormalities listed, okay, get yourself a blank piece of paper. Okay. When you go in to take your test, have your blank piece of paper with you, write those abnormalities down there, and then take a look at those and say, are any of these a life threat? Meaning, if I don't fix these, okay, these things that I see in the ABCs, the issues with airway, breathing, and circulation, something I need to fix right now, or this patient may not survive another 10 or 15 minutes, okay? Those are life threats. If there is a life threat listed in your list of abnormalities with this patient, that becomes your number one top priority. That probably is going to be your answer in some fashion, okay? So look for those. Then go look at your responses and pick one. And lastly, we're going to go look at the other 3 responses that we did not pick and see if there's a reason why they are not as correct as the one we picked. Okay? If they're not, then we know we picked the right one. If we've got one that's maybe as correct as the one we picked, then I need to go back and look at the one I picked to make double sure that that's the right one. That's about the only time I'm going to second guess myself here. Okay? So, get our responses, look at them, and make sure we've got the right one. All right, let's try this. Okay, we've got a 43-year-old male patient whose wife called 911 because her husband was difficult to wake up. He is now lethargic with garbled speech. She reports that he has a history of diabetes, stroke, renal failure, and high blood pressure. Patient's airway is patent. His respirations are tachypneic but adequate, and his radial pulse is rapid. Your partner tells you that he found the following vital signs: a pulse of 136, respirations of 22, a blood pressure of 106/62, SpO2 is 92%, and his blood glucose level is 642. What would be the most appropriate action in the care of this patient? Okay, so what is the question asking for? Okay, it's asking for, what do you need to do to take care of this patient? Okay, so next step is, we know what the question is asking for. The next step is finding what is abnormal about this patient. So right now I want you to pause, hit pause on the video, take a piece of paper, and write down those things that are abnormal about this patient. Okay, once you have that done, click play, and we'll finish through this. Okay, go ahead, pause, and I'll see you in a moment. Okay, hopefully you have your abnormalities written down. This is what I found. Okay, patient is difficult to wake up. He is lethargic, and he has garbled speech. Okay, now there's a few other. He's tachypneic. He has a pulse of 136, which is high, SpO2 of 92, which is a smidgen low, and his blood sugar is like through the roof. Okay, you'll notice I did not pick diabetes, stroke, renal failure, and high blood pressure as abnormalities for him, because these are normal for this patient. All right, things are going to get thrown in here, guys, that are going to be distractors. This is where you're going to find them. Oftentimes it's in the history of the patient. Now, sometimes history of a patient's valuable, and it's stuff we need to know. But when we're looking for abnormalities, we're looking for what is abnormal about this patient right now. Okay, those are not abnormal. Those are his normals. So we're going to deal with the abnormalities. Okay, next thing we're going to look at is, are any of these that we found a life threat? Okay, so if I look through here, guys, I really don't find any that are a life threat. I find some concerning ones. His lethargy, his hard to wake up, his garbled speech, those have me concerned, as does the blood glucose. That's quite high. But none of this is going to kill him in the next 10 minutes. So I don't really have anything wrong with my A, B, and C. Okay, so we're going to look at this and say, okay, what is the best option that we have? Because we know that the question is asking us, what is the most appropriate action for the care in this patient? So let's look at these and go through here and see. Okay, let's look at A. Could we administer supplemental oxygen? Well, I'm looking at the SpO2, it's 92, so yeah, that could be correct. Okay. B, administer oral glucose. No, this patient already has too much glucose. Is it 642? So that one I'm going to say, I'm going to take that out right away and say, no, that's not correct. Okay. If I look at C, encourage the patient to drink water. Okay, maybe that's correct. I mean, high blood sugar, he's probably dehydrated a little bit because he's been peeing a lot. So maybe, so that could be correct. And then if I look at D, assist the patient with taking insulin. Now, guys, this one is trying to pull you in. Does this patient need insulin? Yes, he does. Because his blood sugar is high, we need to open those cells so the insulin can move into the cells. So the blood sugar can move into the cells. The insulin is the key that opens the cells. Then the cells could use the oxygen. I've got y'all mixed up. If the insulin opens the cell, then the cell can use the glucose to create energy, and hopefully that would improve his mental status. The blood sugar would drop, and we would be on the way to being better. However, nowhere in your EMT scope of practice did we teach you how to give insulin. Okay? So if you don't know how, you don't know the dosages, we've never talked about this, this is not in your scope of practice, that will land you in a world of legal trouble. So I'm going to say no to this, okay? A, the patient is lethargic and not thinking correctly. He's not going to be capable of giving himself insulin. So even me assisting, I don't even know how to do it myself. How am I going to assist him? Okay, so let's say no. Stay in your lane. Stay in your scope of practice. Does that make sense? Okay, so now let's look at the two that could be right. Okay, oxygen could be right. How about encourage the patient to drink water? I mean, he is probably, is dehydrated. But if we're not going to give oral glucose, well, he doesn't need oral glucose. So could we give him water? We could. Let's go back and read through these abnormalities. He's difficult to wake up and lethargic, which means, do I want to give water to a patient who can't speak or be fully awake? Is that a wise thing to do? Or might he aspirate that into his lungs? Okay. So because this may cause harm to my patient, I'm going to say no go on it. That leaves me with one answer, and that is the oxygen. Now, it does not address the blood sugar issue. Okay? It's still the right answer. Okay? Because we as EMTs can't do anything about that blood sugar. So knowing that oxygen is our best option is the right answer. Okay? It's easier than you think. Let's do one more quick. All right, get you a clean piece of paper. Let's look at this one. All right, we've been called to a long-term care facility for a 77-year-old female who was found unresponsive in her wheelchair by the staff. The nurse reports that the patient complained of a headache earlier in the day and was given 600 milligrams of Motrin. Your assessment shows the patient to be unresponsive with a patent airway, slow and irregular respirations, and a weak radial pulse. Her lips are cyanotic, and your partner reports the following vital signs. Okay, pulse of 44, breaths of 6, a blood pressure of 228 over 116. Which action should be your next priority? So remember, we're reading the question. We're asking ourselves, what is it asking for? So in this particular case, it's saying, what is your next action? Immediately, what are you going to do for this patient? Okay, so knowing that, I don't really care what's causing this. There's some other things I don't care about right now. Let's find the abnormalities with this patient so we can find out what our next action should be, shall we? All right. So what I want you to do is to grab your piece of paper, pause this video, and let's see what are your abnormalities. So pause the video, write your abnormalities down. I mean, you guys don't have to do this because I'm not going to reach through this video screen and shake my mom finger at you if you don't. But it's good practice. I'd like for you to get used to doing this, okay? Find out what those are. See you in a second. Okay, so we're back with the abnormalities. So this is what I found, okay? She was found unresponsive. She did complain of a headache earlier. The fact that she's complaining of it and it was treated tells me this isn't normal for her, okay? So she's unresponsive. We got that already. She has slow and irregular respirations, okay? A weak radial pulse. She is cyanotic in her lips, okay? And on the vital signs, we found some abnormalities. A pulse of 44, breathing at 6 breaths per minute, and a blood pressure of 228/116. Okay, so we've got some things that are abnormal. Our next question is, are there any life threats? Okay, so when I look through here, she's unresponsive. That is very, very concerning for me. That tells me her brain isn't functioning. So let's look in the ABCs and see if there's anything I need to fix. So A, airway. It says that she is breathing, okay? So her airway's patent. Let's look at B for breathing. Breathing, is it adequate? It doesn't really tell us about chest rise, but it says her rate is 6. That's a problem. Slow and irregular respirations, a breathing rate of 6. Those are a life threat. Then I've got the blood pressure, which is high. It's not a life threat at this moment. So I have a life threat right here. Slow, irregular respirations at a rate of 6. I got to fix this before I go any further because this will kill her. Does that make sense? So that is my priority. Okay, so let's look at this. Here's the answers. Let's talk about them. Okay, start positive pressure ventilations. Yeah, I think that's a great answer. Okay, let's look at the next one. Check the blood glucose level. I don't know. That's not more important than her breathing. Okay, and her blood glucose level could explain why she's unresponsive. It could, but we have a bigger fish to fry right now. So I'm going to say no on that one. Okay. Do I need to attach a pulse oximeter and get an SpO2 reading? Possibly, but I don't know. Her lips are cyanotic. I mean, so this is possibly correct, but she got cyanotic lips. I kind of know that she's already not doing well in the perfusion aspect. And then the last one is perform a pre-hospital stroke screen. Okay, if I look at this patient and I look, she complained of a headache earlier. She has a history of, that was the last one. She doesn't have a history, okay? She had a headache earlier and now she's unresponsive. Okay, but look at this, guys. She has a pulse of 44, so her pulse rate's down. Her blood pressure is through the roof, and her breathing is irregular. Is this ringing any bells? Ding, 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 ding. Like Cushing's triad? Maybe? Okay, so it doesn't matter. Did she have a stroke? Could she have had a hemorrhagic stroke and it's causing this pressure in her head? Yes, it could. But the question is asking for what is my next priority. And so I'm going to go with this next priority. I have to go with the BVM. That is her life threat right now. And that is my answer in this question because the other three, none of them are more important than positive pressure ventilation. Okay? So, whoops. I hope this helps. I lost my sign. All right. Hope it helps. Keep those in order. Know the terminology. Read your question. Ask yourself, what is the question asking for? Are there any abnormalities with this patient that are abnormal for this patient? And of those abnormalities, are there any of them that are a life threat? Okay? If you have a life threat, that is your priority. So I encourage you, grab a quiz, some practice quizzes, an app on your phone, practice this technique. You get good at it, and I promise you your test scores are going to go up. All right, guys, fabulous. Good to spend some time with you. We will talk to you soon.